In this podcast episode, Joe Rogan welcomes Casey Means and Calley Means, advocates for health and nutrition, who share their insights on the alarming state of public health in America. They discuss the influence of the food and pharmaceutical industries, the rising rates of chronic diseases, the impact of processed foods, and the urgent need for a paradigm shift towards preventive health measures and holistic wellness. The guests begin by discussing their backgrounds, revealing how they transitioned from traditional roles in medicine and politics to becoming outspoken critics of the food and pharmaceutical industries. Their experiences in Washington, D.C. and medical school led them to uncover systemic issues that contribute to the rising rates of chronic diseases, particularly among children. Calley Means recounts his time as a lobbyist, where he witnessed firsthand how the food and pharmaceutical industries manipulate public perception and policy. He describes working with major corporations like Coca-Cola to influence institutions and organizations, including steering funds to academic research that downplayed the dangers of sugar and obesity. This manipulation extends to the National Institutes of Health and the American Diabetes Association, which have been criticized for promoting guidelines that benefit corporate interests rather than public health. The Means argue that this corruption has led to a healthcare system focused on managing diseases rather than preventing them. The conversation highlights the staggering statistics surrounding chronic diseases in America. Casey Means pointed out that 74% of Americans are overweight or obese, and 50% of adults have type 2 diabetes or prediabetes. The rates of early-onset dementia and autism have also skyrocketed, with 1 in 36 children now diagnosed with autism. The Means emphasize that these conditions are not isolated but interconnected, stemming from a broader issue of metabolic dysfunction caused by poor diet and lifestyle choices. A significant portion of the discussion focuses on the role of processed foods and environmental toxins in driving these health crises. The Means explain how the introduction of high-fructose corn syrup and other additives has made food more addictive, leading to overeating and obesity. They also discuss the prevalence of endocrine disruptors, such as plastics and pesticides, which contribute to hormonal imbalances and early puberty in girls. The conversation underscores the idea that the modern food environment is designed to keep people unhealthy and dependent on pharmaceutical interventions. Casey Means shares her experience in medical school, where she learned little about nutrition or the interconnectedness of bodily systems. She notes that 80% of medical schools in the U.S. do not require a single course in nutrition, despite the fact that 90% of healthcare spending is tied to preventable diseases. This lack of education perpetuates a system where doctors are trained to treat symptoms rather than address root causes. The Means argue that this siloed approach to medicine is a significant barrier to improving public health. The Means call for a radical shift in how society approaches health and wellness. They argue that the current focus on pharmaceutical solutions is misguided and that a more holistic understanding of health is necessary. By prioritizing lifestyle changes, such as improved nutrition and increased physical activity, they believe that many chronic diseases can be prevented or reversed. They emphasize the importance of empowering individuals to take control of their health rather than relying on a broken system that profits from illness. The conversation also touches on the corruption within scientific research, particularly regarding the funding sources for studies. The Means point out that many studies are funded by the very industries that stand to benefit from the results, leading to biased conclusions. They highlight recent allegations of fabricated data in Alzheimer's research, which further erodes public trust in scientific institutions. This corruption, they argue, is a symptom of a larger problem where economic interests overshadow genuine scientific inquiry. For instance, they mention Dr. Fatima Cody Stanford, a prominent obesity researcher funded by Novo Nordisk, who has publicly stated that obesity is a brain disease requiring aggressive intervention. This perspective, they argue, overlooks the importance of lifestyle changes and the need to address the food system that contributes to obesity. Throughout the discussion, the Means emphasize the interconnectedness of human health and the health of the planet. They argue that the current health crisis is a reflection of a broader ecological crisis, where human actions have led to environmental degradation that ultimately impacts our well-being. They call for a more integrated approach to health that considers the effects of our food systems, environmental toxins, and lifestyle choices on both individual and planetary health. The conversation shifts to the role of food policy in public health. The Means emphasize that the current agricultural policies heavily subsidize processed foods, making them cheaper and more accessible than healthy options. They argue that this system is rigged against families who want to provide nutritious meals for their children. The Farm Bill, which allocates significant funding to commodity crops, is criticized for perpetuating a cycle of unhealthy eating habits. They call for a reevaluation of these policies to prioritize whole foods and regenerative agriculture. The Means stress the importance of strong executive leadership in addressing these systemic issues. They believe that a president who prioritizes health and wellness can drive significant change in healthcare policy. They point to the potential for a bipartisan approach, especially with figures like Trump and RFK Jr. emerging as advocates for health reform. They argue that these leaders can challenge the status quo and push for policies that promote metabolic health and disease prevention. The Means highlight the power of grassroots movements in effecting change. They believe that if enough people demand a shift in healthcare priorities, it can lead to significant reforms. They encourage individuals to take action by contacting their representatives and advocating for policies that support health and wellness. The Means express optimism about a cultural shift towards health and wellness. They believe that more people are becoming aware of the importance of metabolic health and are seeking ways to improve their well-being. They argue that this shift is not just about individual choices, but also about creating a supportive environment that encourages healthy living. They envision a future where families prioritize cooking and eating whole foods together, fostering a sense of community and connection. Technology is also discussed as a tool for empowering individuals to take control of their health. Casey mentions her work with Levels, a company that democratizes access to continuous glucose monitors, allowing people to understand how their diet affects their metabolic health. By providing real-time data, individuals can make informed choices about their nutrition and lifestyle, ultimately leading to better health outcomes. Throughout the conversation, the Means advocate for a holistic approach to health that encompasses not just diet and exercise, but also mental and emotional well-being. They argue that the current healthcare system often neglects these aspects, focusing solely on treating symptoms rather than addressing the underlying causes of disease. They emphasize the importance of community, connection, and a supportive environment in fostering health and wellness. In closing, the Means urge listeners to take action in their own lives and communities. They encourage individuals to educate themselves about the food they consume, advocate for healthier policies, and support initiatives that promote metabolic health. They believe that by working together, it is possible to create a healthier future for all Americans, one that prioritizes well-being over profit.